May is Mental Health Awareness Month, and one new treatment called magnetic e-resonance therapy is being used for PTSD, depression, and many other things.
And joining us now to talk more about this treatment is Dr. Julie Kim from Wave Neuroscience. Thank you so much for being here today. We appreciate it.
Thank you for having me.
Welcome to the Fox 5 studios.
Thank you.
Explain to us what magnetic resonance therapy is exactly, because I think a lot of people don't know.
Yeah, so magnetic e-resonance therapy is short, we call it MERT. It is a EEG-guided TMS delivery. And so it is magnetic stimulation transcranially. We deliver treatment non-invasively, non-pharmaceutically to the brain to find areas of disruption, find areas of maybe underdevelopment, and try to use this magnetic stimulation to regain some of that synchrony or organization of activity.
It's almost like getting it back online in some ways.
That's right. That's right.
So, go ahead.
Yeah, so we first do an EEG, we map out the brain, we look for areas of disruption, then we send that EEG to Wave Neurosciences, who gives us a protocol. And what we do is we get that personalized protocol, and then we deliver the treatment.
And that's what we're going to ask you next, is really how is this therapy used to help out people? What are the benefits?
Yes, so we've seen it, we've used it in a wide range of cases. We've used it in children with autism. We've seen benefits in PTSD, traumatic brain injury, depression, anxiety, and many of our population are children with autism. So we've seen it in a lot of different varieties of cases, and it's actually FDA cleared for depression. And so it's been around for 30 years. However, Wave has taken it from the standard TMS to make it personalized using EEG guidance and using it to treat kind of outside the box, off-label. And we've seen great successes in diagnoses other than depression.
You know, it is interesting. I have heard of cases where people who are on the spectrum, children, oftentimes nonverbal, come in and undergo this treatment and actually come out speaking at the end of the treatment.
Yes, so in the past 10 years, we've treated about 6,000 patients. Half of them are children with autism, and we've seen increased awareness, increased eye contact. We've seen children who are nonverbal speak their first few words. We've seen children with language use words more spontaneously, use words and form sentences. So we've seen pretty remarkable results.
And what makes this treatment better than others? Because a lot of people think, oh, you just need medication to help with this stuff, but that's not the case.
Not always.
Yeah.
And if we can find the root problem, we can map out the brain and see where that disruption is, we can do it non-pharmaceutically, non-invasively. And, you know, coming from medicine, internal medicine myself, you know, I'm so used to writing prescriptions, and it's such a gift to be able to see these changes in such a short amount of time in these patients.
You know, we've seen a lot of veterans who come to you for help, PTSD, traumatic brain injuries. Talk about how this treatment helps.
Yes, so when many people have, you know, a pretty typical brain to begin with, and for whatever reason, there's trauma, there's injury, especially you mentioned the veteran population, there's some disruption. And so when we could organize brain back into its normal state, its resting state, we see a lot of those symptoms that manifested from that disruption disappear.
So things like depression, things like mood changes, mood disorders, things like that.
Yes.
You just, again, I don't even know how to simplify it, but it's really about getting the brain to connect to where it normally used to.
Right, trying to reset and synchronize that brain activity so it optimizes the function.
What's it like for you? I mean, you see this, you know, you hear it, so well, it's just kind of spacey science stuff, but then you really see the application. It's amazing, right?
Yeah, it is, it is. It was pretty dramatic for me. I was used to writing prescriptions, I was used to seeing patients, you know, for months and months, getting therapy and treatments and different medications, trialing one, trialing another, and then to see these dramatic changes in 2 weeks' time, 6 weeks' time, it was remarkable. Patients who hadn't slept for years started sleeping through the night. Spouses would tell us we have our husband back or we have our wife back again. It was pretty dramatic changes. And
It's amazing to see the changes. I will say I actually have been a patient of yours, and I have done this treatment before when I had chemo brain, and I couldn't remember anything. And so it helped me get back to where I was, you know, thinking as quickly as I have to, doing the job that I do, and getting me back to doing the things I love. So
That's wonderful.
You know,
Yeah,
I can tell you it doesn't hurt. It's not something that's painful. So it's really quite fascinating how it works.
Yeah, and just syncing that brain and optimizing it and giving people the opportunity just to be back to what they were.
All right. Wow. Dr. Julie Kim, we appreciate it. Thank you so much for coming in. If you'd like to learn more about Merge, just go to fox5sandiego.com and click on the Scene on Fox 5 tab. We'll have all the information there. Thank you, Doctor.
Thank you very much.